High-profile GP Lance O'Sullivan has renewed calls for compulsory vaccinations, saying parents who don't comply should pay more tax or have their benefits docked. More on that shortly, but at December last year, only 88% of 5-year-olds were fully immunised. The Ministry of Health is aiming for 95%, although Labor scrapped official immunisation targets. The West Coast has the lowest vaccination rate at just over 70%. It's about 78% in the Bay of Plenty and just 83% in Northland. So why are some areas not vaccinating as much as others? Our reporter Lois Williams spoke to parents in Whangarei about their view on immunisation.
I do believe there's personal choice, but that personal choice does affect people that don't have the immunity, as well as I know quite a few young babies too early to be vaccinated, and that concerns me. It's a worry that those parents shouldn't have to worry about that going to the supermarket or places like that.
I've been vaccinated twice because when they gave me my first vaccination and they tested me, I had no immunity, so they had to give me another one because I was pregnant at the time.
Okay. How long ago was that?
34 years ago.
Yeah. So your girl has been vaccinated?
Yep.
How old are you?
23.
What do you think of people who don't vaccinate their children?
Yeah, they're putting other people at risk too, and other children, and I think they should be vaccinated, especially if they're in the community like childcare, schools.
Are your children vaccinated?
No.
Grandchildren, your mockers. Do you want to get them vaccinated?
No.
Why's that?
Because we looked hard into that when they were born, and that was the decision we took.
Not to vaccinate?
Not to vaccinate.
So will you be taking any particular measures to protect them if there's an outbreak up here?
So if we know there's an outbreak out here, if she was in a place that had the outbreak, would we take her there? No. Yes. So we would take measures, yeah.
Dr Lance O'Sullivan has a different view. He says that successive governments have been too timid in reaching immunisation targets, and we need to bring in compulsory vaccination with penalties for those who refuse to comply. Now, he's already floated this idea of penalising people who don't vaccinate their children with benefit cuts. But what about those people who aren't on a benefit?
If you're not on a benefit, but you've made a decision not to immunise your children, and we can calculate that the cost to country for every vaccine preventable condition and illness should be covered by people that don't vaccinate themselves or their family, then there's probably even a solution there. I'm not a tax expert, but I think we have to use every lever at our disposal to ensure that we have people following science and the best practice and to protect everyone.
So, in essence, fine people?
Well, look, we fine people for other things that are even probably more trivial, that have less impact for harm and even death.
Like what? What's the comparison that you're thinking of?
Well, obviously a seatbelt law. I mean, we wear seatbelts 100% of the time in the very unlikely event that it'll ever save our lives. The protection offered by immunisation is far greater, and yet we don't make it compulsory. We don't have boundaries around enforcing it.
OK, so that's a punishment. What about a sweetener? What do you reckon about offering a sweetener or a cash bonus for bringing your kids in to be immunised? Doesn't have to be a punishment, does it?
Well, I don't know if we should talk of it through like as a punishment or a cash bonus or a reward thing. This is about, people making sensible decisions based on evidence, and at the end of the day, an incentive for people to immunise their child is to protect their child and that of and other people in the community. If we start incentivising every little thing that a decent citizen should do, I think we're going down the wrong track.
But that incentive already exists, and we are not hitting the immunisation rates that we want. So the incentive to keep your child healthy and keep other people healthy and keep the so-called herd healthy, that already exists, and we are not meeting our targets. So
that's right. So we need to be more prescriptive, and this comes back to what is being said by others more than just me, is that, okay, in this situation, how do we guarantee that we're going to get the numbers, the percentage of population that we need to be immunised to protect everyone, we make it a compulsion. We make it a compulsory act, and this is a discussion that needs to be had. We're going to have this discussion time and time again every time there's an epidemic. I mean, I don't know of any other solution other than trying to educate people, but that's not happening, and then actually quite the opposite. We've seen a reverse in immunisation rates because of this very vocal and strong anti-immunisation lobby.
Yeah, because some people would regard compulsion as very nanny state, obviously.
Yeah, and I mean, that's always, a comment that gets made. But I mean, in the day, we have some rules around how we live in society to protect everyone, and this is a sensible move, is to ensure that we have a majority, the most we can immunise, most children and people we can immunise. If people think that creating a society that's caring and safe is nanny state, then so be it, but it's a society that cares and keeps people safe. What we do know, with this worrying decrease in immunisations that is occurring through this misinformation machine, we are going to see children die from vaccine-preventable diseases.
How confident are you, though, that the immunisation rate and the lack of it is tied to the anti-vax message? How much is ignorance or apathy versus the anti-vax message?
Well, look, in 1993, 1995, I think, Andrew Wakefield, the disgraced clinician from the UK, suggested there's a link between MMR and autism. In the last 2 to 3 decades, what we've seen is a 30% increase in measles and a reduction in people wanting MMR vaccination. So we know that misinformation, this is discredited, has actually caused children to die. So we know that that's clear. What other drivers like apathy? Absolutely. I mean, when I lived in Kaitaia, I had a woman who wouldn't immunise her children. It wasn't a deep philosophical opposition to immunisations. It was, to be honest, she couldn't be bothered. Now, if we had said to her, well, your benefit will be reduced by this amount because you're choosing not to immunise your child, I can guarantee you she would have immunised your child.
What role does poverty play? Because if you look at the statistics on the Ministry's website, areas where there are lower incomes tend to have lower rates of vaccinations. Yeah,
and so how worrying is that? I mean, the most vulnerable, those that are living in homes that are unhealthy, those that are probably born premature or live in smokers, and nutrition is an issue, are the least protected. That is such a worry, and that's why I rage against people coming into communities like Kaitaia and encouraging my community not to immunise their children. The reason why...
But hang on a minute, and I'm sorry to interrupt, Lance, but what you are suggesting is punitive measures to make sure people get vaccinated. So you're talking about docking benefits and taking money away. You're just exacerbating the problem, aren't you, by doing that?
Okay, so the same argument, Lisa, was held for increasing taxes on smokes, okay, on cigarettes. The poverty, if people in poverty smoke more, so if you put the cost of cigarettes up, you're going to create more poverty in those homes. Now, to be frank, that is not a situation a position we should find ourselves in. We're not doing the right things because, of thinking we're going to make the situation worse. We actually are making it worse because when a pregnant mother is smoking and has a premature baby, that's going to cost her and the country far, far more than what we were trying to do by increasing taxes on her cigarettes.
Just before we go, Lance, are you fully immunised? Because people born after 1969 and before 1990 need to check, don't they? So do you know if you're fully up to date?
Look, so I probably have not got my full protection against measles, and someone asked me this morning. There's a limited number of booster vaccines available, and I know that those should go to the most vulnerable and those that were most likely going to have serious complications of coming across the measles.